Hey everyone, Eric Christensen here, pharmacist from meded101.com. I've been working with pharmacists, helping them pass and prepare for board certification probably for about 10 years or so since I first started posting a little bit on MedEd 101 about these exams. I've taken board certification exams 4 different times on initial certification and recertification now. So definitely have plenty of experience in trying to navigate these exams, which can be really, really challenging. So today I want to talk about the geriatric certification exam. So that's the BCGP exam, specifically for 2024. Looking at that content outline and try to give you some ideas of what I would do if I was in your situation trying to plan and prepare for this. So first and foremost, eligibility is a question I get all the time. This is directly taken from the BPS website, who's the organization that handles the majority of pharmacist board certifications. I won't read through them. I will point out a lot of pharmacists are like, I don't qualify for this, particularly when they look at least 4 years of specialty area practice with at least 50% of that time spent in the scope defined by the exam content outline. Well, I would definitely make the argument that many of you do work in geriatrics at least 50% of your time. So if you're in a community pharmacy that's dealing with geriatric patients 50% of the time, which I would say is probably most, that's a situation where you can demonstrate that experience, get approval from an employer, a signed letter of attesting to that, and you should be able to sit for this exam without issues. So that's one thing I think that people get a little bit nervous about. And honestly, I have never heard from a pharmacist, and I get quite a few emails on pharmacist board certification. I've never heard from a pharmacist that has been refused or their certification revoked because the board didn't feel like their eligibility was good enough or their background was good enough. So with that said, I haven't seen or heard a case where somebody's been refused who's applied to sit for the exam for this specialty. So keep that in mind when you're reviewing the eligibility criteria. Now, if you've just graduated and you haven't, completed a PGY1 or that type of thing, yes, you're probably going to be rejected in that situation. But I don't think I've had anybody that's tried to apply because I think you can easily read that eligibility criteria. In addition to eligibility, the thing I get asked about probably the most, other than preparing for studying, what should I do, is pass rates. The BCGP exam is challenging for sure. So you can see all candidates who took the BCGP exam, it had the lowest pass rate of 50%. So with that said, I definitely tell candidates expect to take this exam twice. And I think that sets you up for a situation of where there's not so much pressure on yourself. Hey, I absolutely have to pass this exam the first time. Now, I think it's important to plan and prepare for that, but I think it's important to set the expectations that you're a busy pharmacist working full-time, likely working full-time. You've probably got family, you've probably got other commitments. It's okay if you don't pass this exam the first time. So definitely, in my mind, I think it's a lot easier on people if you have that mindset, which is difficult to do for pharmacists. A lot of us are type A personality. We want to, do things the right way. We want to do it right the first time. And I strongly encourage you to prepare and plan and study very hard for the first time, but have that realization that pass rate is very, very low. So let's get into the exam a little bit. So this has dropped. The number of questions in the exam has dropped over the years. It used to be 200, then it dropped to 175, and now in 2024 and going forward, we're at 150 questions. I'm kind of torn about that a little bit. I always felt like if I had more questions, I had an easier ability to prove myself versus less questions. But still, 150 questions, that's a good chunk. Multiple choice, one answer with 4 possible choices. That is the test format. There's no fill in the blank, there's no essay, nothing like that. So in my mind, that's easier for me, but may not be for some people that do well maybe with essays or other things. Timing, 90 seconds per question is what you should plan for. I say to even probably get a little bit more aggressive than that as you're going through practice questions, whether you use our study materials at MedEd 101 or you use somebody else's. Plan on 60 seconds per question on average. I think that's a good target to shoot for. That way, you've got plenty of time. You don't feel rushed as you're getting to the end. God forbid you don't miss questions or not get to questions. I have had people reach out to me saying they didn't finish their exam, and those all count against you. So you've got to finish that exam. So make sure that you're paying attention to that. And I would again target that 60 seconds per question when you're going through practice questions. Generic names, that's a question that always comes up. Is it branded generic names? All the BPS exams use generic names. In your mindset, when you're in there taking the exam, remember 25 questions are not graded. Okay? So if you feel like you get off to a really bad start, oh my gosh, I had the first 4 questions, I had no idea what the answers were. Take a deep breath and recognize that there is the possibility that they could be just testing questions that aren't graded for future exams. Okay? So again, don't get crazy frazzled if you really, really struggle when the exam first starts, because some of those questions may not be graded. Now, they may be graded, but you've got to recognize that some of them may not be graded, and you don't know which ones are which. And then I do recommend going through the content outline. I'm going to do that in this video going forward here. I think the biggest surprise to pharmacists who take this exam is the number of geriatric patient population questions. Okay? 29% is a huge chunk of the exam. So in my mind, this is really non-pharmacotherapy stuff. So it's not about, what antibiotic is the best to use in a geriatric patient. This is more physiology, pathophysiology, geriatric syndromes, like falls and things of that nature, cognitive issues, activities of daily living. That's not something that we do a lot as a pharmacist in practice. We're more focused on medications and things of that nature. Same thing with elder abuse, ageism, caregiver support. These are things that we don't really do a lot, or at least most pharmacists don't do a lot. And so you've got to take the time to study this section. We do, I think, a great job compared to other study materials. I've got a PDF that describes all this stuff, explains it, the definitions, what's behind it, as well as videos on this content as well in our study package. But do not overlook this area. I think this is why we've got that 50% pass rate on this exam, because people don't think about this. All they think about is pharmacotherapy and selecting appropriate medications in older individuals. They don't think about some of this non-medication related content that you do need to study for. So therapeutics and patient management. So this is your pharmacotherapy sections, treatment planning, therapeutic implementations, treatment outcomes and monitoring. Basically selecting the best drug possible in a given situation or recognizing issues with certain medications in our geriatric patient population. Delving into this a little bit deeper when you're setting up your study plan, focus on your weaknesses, and start with the most common topics. So, diabetes, asthma, COPD, depression, pain management. Those are your, big heavy hitters. Things like maybe multiple sclerosis, disease states that don't have either a lot of pharmacotherapy or are not very common. Don't get bogged down in the details in some of that stuff. Again, focus on geriatric pharmacotherapy. And then 2 simple concepts is what I relate this concept down to is understand why you would select a medication and understand why you wouldn't select a medication. Digging a little deeper into that, be prepared to analyze case scenarios, and then with that drug selection, why you would or wouldn't select a medication, contraindications, compelling indications, guideline-directed therapy, major unique adverse effects, monitoring parameters, drug interactions, a reason why you might avoid selecting a medication, pharmacogenomics, genetic considerations as well. And one question I get asked about studying for the pharmacotherapy, medication-related section is, do I need to know dosing? And I would say it's probably a yes and no. I wouldn't focus on it heavily. But if you've got specific drugs where there's specific dosing for geriatric patients, Zolpidem is a classic example that comes to mind, where we may want to reduce that dose in a geriatric patient. Another one is apixaban, where age, renal function, weight, those are reasons why you would adjust the dose of that medication. So, I think of anticoagulation, you're probably going to want to know dosing in that situation. You may think of certain antibiotics for certain conditions. You may think of different indications having different dosing. Maybe some of the diabetes medications come to mind there, where maybe we've got different dosing for obesity compared to different dosing for diabetes care. So think about those instances and those situations where those dosages change, and there may be a different maximum or recommended maximum based upon either the condition you're treating, or if we've got a geriatric specific dose maximum that we need to recognize. And last but not least, I definitely do not want you to overlook what's categorized as the professional practice portion of the exam. This is a lot of the statistics, research methods, that sort of thing may show up here, but there's also other things as well: ethics, patient advocacy, pharmacoeconomics, start criteria, Beers criteria, FORDA, MAI. These are all things that you should pay attention to. And again, we've laid these out in our study materials, making sure to cover all these topic areas. But you cannot overlook this. 21% is a very, very good chunk of the exam. And if you get not very many of those right, you're going to really handicap yourself and have to do really, really well on some of those other areas. Just a few testimonials from last year and previous years. Like I said, we've been putting together study materials for probably about 10 years now. We've updated content. We get feedback from folks saying, hey, you should have covered this topic more, should have covered this area more. So we've adapted, adjusted, and then also altered our study materials based upon the content outline and those changes throughout the years too. So some testimonials here. Link to our study materials, meded101.com/store. Please feel free to email me if you've got questions about our study materials or BCGP exam in general, mededucation101@gmail.com. And I'll put that link in the comments section in YouTube there as well to the meded101.com/store. Just a quick summary, our All Access Pass is video review course, well over 20 plus hours now. We updated approximately 20 videos for 2024. We do this on an annual basis, usually at the end of 2023, in that kind of November-December timeframe. Online question bank, as well as 2 downloadable practice exams. We follow the BCGP format exactly. 4 choices, generic names, making sure that you're well prepared for that. Specific statistics study guide. Those are definitely questions that if you study and prepare for statistics, you're going to know those and get those right for sure. And then, of course, we've got our Principles of Aging study guide. It's a separate PDF, some comparison tables, in addition to help you prepare for some of the non-pharmacotherapy things in addition to the pharmacotherapy things as well. So we've got 1 year and 6-month access options. Again, that link, meded101.com/store. You can read more about that or certainly email me at mededucation101@gmail.com. Thanks for listening, and I hope this helps you plan and prepare for taking your BCGP exam.